I appreciate you telling us your story. So you have a surgery coming up, and just as a background, it is very clear that if someone has opioid use disorder and they have surgery, that they should stay on the Suboxone through the surgery. The American Society of Regional Anesthesiology has said this. The American Society of Anesthesiology has said this. All the SAMHSA, the big addiction societies have all said, if someone has opioid use disorder, do not take them off the Suboxone. However, the data shows that 60 to 65% of hospitals around the country do not listen to that advice. Yeah. And this is a big thing that I call the science practice gap, where there is a gap between what the science says we should do and what we actually do. And in this case, I think it comes down to people just haven't learned, they don't know. And so a big part of what I'm trying to do is get the message out there. So you have surgery coming up. Why don't we just talk about what we should do for your surgery to make sure that we keep you safe? Okay. Do you kind of know the science behind it a little bit, or what?
Well, you know, they were talking about doing a posterior, originally, a posterior hip replacement on me, and to me that sounded unappealing the way they made it sound. They said, you know, it was going to be very fragile afterwards, and like it didn't sound like.
And just to be clear for everyone, you have what's called, you have bone on bone and avascular necrosis, and the hip has basically fused together. We have almost no rotation of the hip. Is that right?
It's not fused together. It's just it's got so much arthritis grown up around it that I don't have that much range of motion. So it's like I can't straighten my leg out. You know, it's just like it stays like that.
So you have to get it replaced at some point, and it basically.
I don't have to, but yeah, I need to. It'll make me be able to actually stand up straight, and it'll probably help my back pain.
Will help you walk your dogs better. You have a couple of great dogs.
Yeah.
So you're going to need surgery. So how have you started to navigate the system to make sure that you stay on your Suboxone?
Well, first of all, I changed doctors. I started going to St. Francis, which is like a nicer hospital. I was going to the University Hospital here. Like the new doctors, they're talking about doing a anterior hip replacement, and they're telling me that I'd be able to probably walk home from the hospital.
That's amazing. And did you tell them you wanted to stay on the Suboxone?
Yeah.
Did they say that's going to be okay?
They didn't say it wouldn't be. I mean, I'm not going to let them put me on opiates. I would rather have, I mean, it's my call at the end of the day, but I'm not going to you know, I couldn't imagine them forcing it on me, but I told them straight up out the gate, like I was like, you know, I'm going to do this without any painkillers. I was like, I wanted to know about like what kind of local anesthetics. I talked about the back surgery that I had where they did like some local anesthetics on me, and like honestly, it didn't have any really that bad of pain afterwards. Then I remember like a week later, like I felt like I re-injured or something, but I think it was just the local anesthetics wearing off or something. But I was really impressed with that. If they could do something like that, or maybe just like I could go back and get like another one for, you know, just get me through like the first few weeks. At the end of the day, I would rather deal with whatever pain is coming from this than have to go back into a situation where I'm worried about being strung out on opiates again.
Like, but here's the thing, and just, you know, for our viewers, we don't want anyone to be suffering through big surgeries, okay? The most important thing is, number one, to discuss it with your doctor before you have surgery. If you're on Suboxone and you need a surgery, is to tell them that you want to stay on it through the perioperative period. And there'll be some anesthesiologists that haven't heard of that or don't know how to do that. And honestly, you can print out some papers from, again, the American Society of Anesthesiology or other ones that say the data shows that you should stay on it. So step number one is don't stop the Suboxone. Some people will say for a week leading up to surgery, stop the Suboxone. I guess that's a pretty scary proposition.
It is. I guess it makes it more challenging for the anesthesiologist because of the people.
The receptors are broken. Yeah. So, but the first thing is you just stay on the Suboxone. That is 100% evidence-based. The science is you stay on it through all surgeries. Number two is we can do regional anesthetics. And so this is what you were talking about with local anesthesia. We can actually do hip surgeries now by blocking the nerves that go to the hip, and you will not feel pain. So you would literally be awake during the surgery if you wanted to, which you might want to still go to sleep.
I think that, maybe pushing the envelope a little bit.
But we can basically block the nerves so that you don't have pain. And then the third step is when you start to wake up, you know, they can maybe leave a catheter or continue to numb it. You can literally go through the entire process without opioids and without suffering. But the